These barriers are real. These patient experiences that are troubled are real. Tell me about it.
Yeah, so non-medical switching refers to a practice of insurers when you have a stable patient who has maybe over the years tried several different medications, they didn't work. Finally, they have one that works for them. They don't have as much side effects and they're doing well. And then after they've signed up for the health insurance plan, the insurer essentially forces them to switch medications to a different medication. By either dropping their current medication from coverage altogether or by making out-of-pocket costs so expensive that they can no longer afford their medication.
I'm going to stop you, though. You just said, so you're on you're on a treatment path, you're receiving medications.
Mm-hmm.
It's changed,
yes.
Switched to something else.
Mm-hmm.
Tuesday this, Wednesday another, no notice, no phone call, text, email, Instagram, Pinterest is not there. You're saying this is happening.
Yeah, so it's a bait and switch tactic, essentially. A lot of times the physician isn't even informed, so they don't even know that their patient is forced to take a different medication. And we're not talking about switching from a brand to generic. It's an entirely different treatment. And this can violate several consumer protection laws currently in place, contract law, because you're in a plan and then your medication has changed, so that's a violation of the contract. But we are seeing it take place now.
You're saying 2 points then. You mentioned the legal aspects, responsibility aspects, but I mean, you're saying that these patients, besides having their rights violated, they're having their treatment path violated? Mm-hmm. They've suffered adverse health effects?
Yes. So, and this is a thing that we want patients to speak up against because it's an interference with the physician-patient relationship. Sure. It's taking their choice away. So we've created a website called coveragerights.org, which you have pamphlets available to you, which informs patients on what they can do if they are switched or if they go through other policies that insurers are imposing, such as step therapy, which requires you to try and fail on a cheaper medication, sometimes inferior with adverse events, before they can take the medication that was prescribed to them. So this website will inform you how to appeal. If you don't win the appeal, then how you can request an independent review organization to have a second opinion and then file a complaint with your insurance commissioner if that doesn't work. One of the ways that we're trying to influence state lawmakers and legislators is through a survey that we're conducting.
Tell me all about it.
Sure. So the survey, which will come out in 2 weeks, we've interviewed and polled about 1,000 different people throughout the country. We've excluded individuals who are in the health industry, media, or marketing, so it doesn't skew results.
So 1,000 individuals have been reviewed. And,
yes.
And the survey asked them a series of questions?
It does. So it gets to how they value their medications and their health care. It goes over a couple different buckets of questions, including what their expectations are when they sign up for health care. So do they believe that their particular condition is going to be covered? Do they believe that their medication is going to be covered? Then we go into accessibility. So if you have a plan, do you know where you can access that plan? Do you know where to go online? Once you have access, do you understand what it's trying to tell you? Do you understand if certain barriers are in place? And then from there it goes into, have you faced those barriers? A lot of these barriers can be unethical and, as I said, in some instances illegal. So we want to get at how often it's occurring. We can use that data to inform policymakers so they can either enforce laws currently in place or they can enact new laws, such as these non-medical switching laws, to increase protections. And then the last part of it goes into how they personally value their medications. So we've asked questions such as, would you be okay with switching from your current medication to a cheaper medication to save money, even though you could have potential adverse events? And also, what's more important to you, saving up money to pay for your mobile data plan or to save for your copays, things like that. And we anticipate that we will get a lot of very mixed results, but we intend to show with those results that life is full of trade-offs, and that patients should be the ones who are making those decisions about what they want to pay for, whether it be that novel medication that saves their lives or something else. But an insurer or an institution shouldn't be making that decision for them.
What does a future of reform look like?
A future of reform, I would say, is one where there's very strong patient protections in place, where insurers can't use these discriminatory, unethical measures to put their cost savings ahead of the patient's voice and the patient's treatment, where they're interfering with that physician-patient relationship, and that patients are informed enough to take an active role in their health care.